Now let's look at examples for inhibitors and uncouplers of electron transport chain. So this figure, it has so many examples, but in that we will be only considering couple of them, most frequently asked in the exam, that kind of things. So it does show inhibitors of electron transport chain, and then uncouplers also it is showing, as well as it is showing oligomycin, which is also considered as inhibitor of electron transport chain. I'll get into that. Now let's look at a complex 1 inhibitor. I'm going to mark down what are the things that are important. If you want, you mark accordingly. Okay. So complex 1 inhibitor, generally we take these two as most frequently as example, ammobarbital, barbital and rotenone. Ammobarbital and rotenone. These are complex one. These two are the frequently asked complex 1 inhibitor. Is going to block the flow of electrons, protons from complex 1 to coenzyme Q. See, where is the block? Look at the figure. The block is between complex 1 and CoQ. It doesn't allow flow of electrons and protons from complex 1 to CoQ. That's where it is blocked. Okay. And then complex 2 inhibitor, I'm going to take malonate as an example. Malonate. You have studied this already. Malonate. Where did you study malonate? Competitive inhibitor. It's a competitive inhibitor of an enzyme called succinate dehydrogenase, which is a complex 2 in the electron transport chain. Remember, we have three names for complex 2s: succinate dehydrogenase, ETF, glycerol 3-phosphate dehydrogenase. Out of that, succinate dehydrogenase, that is complex 2. That's the complex 2 inhibitor we'll take. And then complex 3 inhibitor, antimycin A. Antimycin A is a complex 3 inhibitor. It will go and block that entire complex 3 there. As it is shown in the figure, it just blocks that entire complex. Do not allow flow of electrons and protons. And then finally, complex 4. Complex 4 inhibitor is, there are three of them. I'm going to write all three and they are all important. Hydrogen sulfide. H2S is hydrogen sulfide. Hydrogen sulfide. CO is carbon monoxide. Carbon monoxide. And CN is cyanide. And these are complex 4 inhibitors. So there are three complex 4 inhibitor. In fact, there is one more. Just for safer side, let me add that as well. Sodium azide. Sodium azide. Sodium azide. So there are four complex 4 inhibitor. Sodium azide, that's number 1. There's some issue with the pen. Just follow what I'm saying. Sodium azide, that's number 1. Hydrogen sulfide, carbon monoxide, and cyanide. These are complex 4 inhibitors. And then oligomycin. Oligomycin here. Oligomycin is inhibitor of ATP synthase. ATP synthase. Remember ATP synthase. That's complex number 5. ATP synthase. Oligomycin inhibits ATP synthase. And then we have uncouplers. Uncouplers, I'll give examples in the later slides. They're shown, uncoupling oxidation from phosphorylation. In the figure, what they are shown is they kind of separate the oxidation on top and the phosphorylation that is shown down here in the bottom. They uncouple both of them. Those are uncouplers. Anyway, in this figure, we have a couple of chemicals to remember. For complex 1, remember ammobarbital rotenone. complex 2, malonate, complex 3, antimycin A, complex 4, 4 of them. Sodium azide, hydrogen sulfide, carbon monoxide, and cyanide. Many times, complex 4 is asked frequently, including me. I don't know why. There is just complex 4, lot of questions. Complex 4 inhibition. Okay. Other question inhibitors are all means other complexes are also asked, but when you look at the number of questions in the practice sources, it is more for complex 4. That's what I have seen. Okay. So ATP synthase, oligomycin. Let's look at complex 4, that is cyanide and carbon monoxide separately. Otherwise, it can be any of these inhibitors with complex 1, 2, 3, and 4, including oligomycin, can be asked. Okay. So, complex, is it clear? Before I move on to details of other two slides there, is this clear? Like, you need to write down separately the name of inhibitors for each complexes. Complex 1, what are the inhibitors? Complex 2, complex 3, complex 4. Have a list, and oligomycin for ATP synthase. Okay. So if you get that name, you should know where is it is inhibiting. So coming to cyanide and carbon monoxide, little more details of this. Cyanide, it's a complex 4 inhibitor. As you know, complex 4 is referred as cytochrome A3 complex, also called as cytochrome oxidase or cytochrome C oxidase. Okay. And the sources for cyanide is house fires. You know that sofa, mattress, all that, when it burns, it releases carbon monoxide as well as cyanide. House fires are the source for both complex 4 inhibitor, that is cyanide and carbon monoxide. You get it from. So that's why exposure to house fire will put a person at risk of cyanide poisoning or carbon monoxide inhalation. Okay, poisoning by inhalation. And then sodium nitroprusside. Remember I mentioned sodium nitroprusside when I began with the case stem. Sodium nitroprusside, one of the byproduct of sodium nitroprusside is cyanide. And then automobile exhaust, it releases hydrogen cyanide. If you are exposed to vehicle exhaust for a long period of time, if you are in traffic, like if you are using a motorbike, right, you may feel headache later, slight headache. Even that happens with carbon monoxide toxicity as well, because vehicle exhaust also has carbon monoxide. So they are inhibitor of complex 4. Acetonitrile and then seeds such as apple seeds. Apple seeds also has small quantity of cyanide. So don't eat apple seeds when you eat apple. Okay. If you collect a lot of that, it will lead to significant quantity of cyanide. I'm not giving you ideas. Don't kill anybody. It is just people tried it. You can see documentaries, apple seed killing people, they tried because it has cyanide. Okay, amyl nitrate along with thiosulfate is an antidote for cyanide toxicity. If a person comes with cyanide toxicity, this is what you are going to inject. That's an antidote. Okay, it will help you in pharmacology as well. Remember that, and that can be part of your choice. It can be part of your case stem. So as and when you see this term, amyl nitrite, think about cyanide, because that's an antidote. Okay. And hydroxycobalamin can also be used sometimes in cyanide toxicity. Hydroxycobalamin in vitamin B12, you might have seen this. There are two coenzyme functions for cobalamin. One is methylcobalamin, other is deoxyadenosyl-cobalamin, right? This kit here, cyano kit, contains hydroxycobalamin. So it will go and bind with cyanide, and it will become a water soluble product and excrete that cyanide out of our body, because it has got higher affinity for cyanide. Hydroxycobalamin has got a higher affinity for cyanide and becomes cyanocobalamin. It attaches to cyanide and becomes cyanocobalamin and excreted. That's how it can be removed from the body. So that's about cyanide source and the antidote. Remember that. Coming to carbon monoxide. Again, it inhibits cytochrome A3, that is complex 4. Remember that. It's a complex 4. Cytochrome A3 is a complex 4. Or cytochrome oxidase, complex 4, right? Less tightly than cyanide. Sources. House fires I have written down there. Improper combustion of organic fuels like propane, gas heaters and gas grills. This is what was a part of case time when we started with. Remember the case time, one of the case time we have seen propane gas heater in a closed apartment, and there people started to feel nausea, vomiting and headache, splitting headache. It's all because carbon monoxide toxic effect, because of inhalation of carbon monoxide. So when you burn a propane gas, that's a cooking gas, right? When you burn, there will be incomplete combustion because it will combine with oxygen and produce carbon monoxide. Some amount of carbon monoxide will be coming out when we use this cooking gas, right? So that's why good ventilation is important in the kitchen. When you are cooking, you open the windows. Make sure you do that, okay? Windows, you keep it open. So that will help you because you won't get headache if you are there standing there cooking for 30 minutes, especially weekend. If you are cooking for entire week, you might be standing there for 1 or 2 hours, right? Is it not? No? At least 1 hour for 1 week cooking. 1 hour. 1 hour you start inhaling all that, and you may not be able to study after that because you might feel little headache. Partly it's because of carbon monoxide. Gas grills, barbecue. Somebody doing barbecue standing there, they feel headache later. They won't notice it if it is not, it's like if it is mild. Vehicle exhaust, tobacco smoke, even chlorine-based paint strips, they all the source of carbon monoxide. Symptoms and signs include headache, nausea, tachycardia, tachypnea, and cherry red. Look at that. Cherry red color blood. Because carbon monoxide binds with iron in the heme and change the color of hemoglobin from red to cherry red. And that's the sign of carbon monoxide toxicity. So that it will help you in answering questions. Coming to the uncouplers, I have explained you sufficiently on uncouplers. What do you see? If you read this now, so it will be, you can understand easily because so much I have done explanation, right? What uncouplers will do? They will do free flow of protons, right? By incorporating in the inner mitochondrial membrane, thereby taking out the electrochemical gradient not built, and thereby there is increase in the body temperature, increase in oxygen consumption, increase in basal metabolic rate. All of you understood this, right? Okay, so that is what some of the information that you got to look for in the STEM to answer questions. Now just you got to remember the examples. Examples for uncouplers. You can divide them into physiological and chemical uncouplers. Physiological uncouplers are referred as uncoupling proteins. They are part of our inner mitochondrial membrane, and there can be different types of them depending on the tissue type. So they can be written as UCP1, that is uncoupling proteins, number 1, 2, 3, 4, 5. There are 4 types. So UCP1 is an uncoupler that is expressed at high concentration in a brown adipose tissue. And UCP1 is referred as thermogenin. So there is higher expression of this UCP1, that is thermogenin, in the brown adipose tissue. Although there is some expression of uncoupling proteins in our skeletal muscle and couple of other tissues, but it's not as significant as compared to what we see the number of uncoupling proteins that you find in brown adipose tissue, and especially in newborns. And we are going to get into that little bit detail on that later. Coming to thyroid hormones. Thyroid hormones, they have an indirect uncoupling mechanism. What they do is they increase the activation of uncoupling proteins indirectly. Okay, I'm going to go a little more into that in the next slide. When I show you the figure in brown adipose tissue, I'll bring this thyroid hormone. So what I want you to know is, whenever there is increase in T3, T4, they do have indirect uncoupling mechanism. That means what? When a person has got higher T3, T4, what is that condition is called? Hyperthyroidism. In a hyperthyroid patient, what do you think about their tolerance to heat? Do they tolerate heat or they are heat intolerant? They are heat intolerant. They won't be able to tolerate it, right? Heat intolerant. So that's why they will have some small little fan or something always in the AC. Like, try to keep themselves, their body temperature a little bit down, right? And also, what do you think the overall morphology of hyperthyroid patients? Are they overweight or underweight? They're little skinny because of BMR, basal metabolic rate is super high. Whatever the food they eat, they kind of burn it out into heat. Is it not? Because uncouplers, what they do? They increase basal metabolic rate, oxidize all these molecules, and they produce less ATPs with the same amount of food compared to us. That means like those who have good T3, T4, normal T3, T4, right? So that means their electron transport chain is inefficient. Is it not? In T3, whenever there is increase in T3, T4, electron transport chain becomes inefficient. Why it becomes inefficient? Because you are incorporating uncoupler in the inner mitochondrial membrane, do not allow sufficient buildup of electrochemical gradient. So the electron transport chain becomes inefficient. That means they need more food to make same number of ATP. And that's why they kind of they don't put on weight. That's the thing. Okay. So that's how you need to connect later. Chemical uncouplers. These are ionophores. Ionophores means these are lipid. Basically, what they do, they will be incorporated into the inner mitochondrial membrane and act as a means they will allow free flow of protons and do not allow buildup of electrochemical gradient. So examples I have written here. Aspirin. See, the common drug, aspirin. I heard of this, right? Aspirin. Aspirin at high doses can act as an uncoupling agent. Salicylates. Salicylates, example for salicylates, anyone? Tylenol, acetaminophen. You know acetaminophen? Tylenol is acetaminophen, like paracetamol. Tylenol. That's just a name, not really chemical. So salicylates, example Tylenol, at high doses, it acts as an uncoupler. See the contrasting thing here. Why do you use Tylenol? Headache and fever. To decrease the body temperature. Whenever your fever, like you bring it down to normal, that's why you tell. You take more Tylenol, what happens to the body temperature? It will go up. See the thing here. You are taking it to bring down the body temperature, but if you take too much, it will bring it up. Tylenol toxicity will make someone into hyperthermia and leading to increase in respiratory rate because uncoupling action. Lack of oxygen means need for more oxygen, increase in the respiratory rate and respiratory alkalosis. So many complications. Okay. So 2,4-dinitrophenol is a chemical used in carpentry industry. Act as a uncoupler, dinitrocresol, pentachlorophenol, even succinylcholine, which is an anesthetic, can also act as uncoupler. So these are the uncouplers. You should have an idea. Aspirin, salicylate, 2,4-dinitrophenol, dinitrocresol, pentachlorophenol, and succinylcholine. So mechanism is all of them a similar mechanism. They act as ionophores, allow free flow of protons in the inner mitochondrial membrane. So types of uncoupling proteins I have written the tissues, but the most important one that I want you to know here is UCP1 thermogenin, which is present in brown adipose tissue.